Dealing with COVID-19 is going to be a marathon, not a race. This situation, unfortunately, is going to get worse before it gets better. And the situation is very rapidly evolving. This is a virus that's going to be with us for a very long time. We're going to have to learn to live with each other. The good news, not everyone's going to get coronavirus 19. The more you take care of yourself, the more precautions you take, the better your nutrition, the higher the probability is you're not going to get sick. The other piece of good news is a study that just came out that suggested that warm, humid weather, also known as summer in DC, actually will reduce the incidence of the bug, just like it does in seasonal flus. So there's hope that the summer will actually reduce the incidence of this. There's much you can do to protect yourself and your loved ones, and there's much we can do to help. So let's go over the basics. This is a bad bug, okay? Its presentation is an upper respiratory infection for the most part, meaning that you start off with a high fever, and a fever is 101 plus. You end up with a cough, either a dry cough or a productive cough, but mostly dry. A small percentage of people will actually have some upper respiratory nasal congestion, but that's not the most common thing with this bug. And a percentage of people, not sure how many, maybe 15 max, but 15% of people will have some gastrointestinal problems, diarrhea, bloating, gas, nausea, vomiting. So, but for the most part, we're looking at a respiratory bug. That's what we would expect. However, remember that this is also cold and seasonal flu season, and in Washington at least, everything's coming into bloom, so allergies. So not every fever, not every sniffle, not every cough is COVID-19. If you're concerned, the simplest, shortest route is to call us. One of the goals is we need to make sure we don't overwhelm the emergency rooms. We want to make sure you get the best care, and we want to make sure that if the people who need to be in the emergency rooms also get the best care. So the key here is to make sure that everyone's getting taken care of appropriately. If you're concerned, if you're worried, we would rather hear from you. So the basics, and you all know this: social distancing, 6 feet. Why? Because it out of range of the droplets that carry the virus. If you want to wash your hands, 2 rounds of happy birthday. Frankly, soap and water is every bit as good as Purell. So you don't need anything special, just soap and water and the time to actually take to scrub your hands. When you're out shopping, you want to wear single-use plastic gloves, because this bug can live on surfaces for a reasonably long time. So when you're handling packages or things that have been handled by other people, it's possible for the bug to transmit. So on plastic, study just showed in New England Journal that after 8 hours, only 10% of the virus was still there, but it took 8 hours. It didn't become completely undetectable until 72 hours. Stainless steel, the numbers plummet pretty much after just 4 hours, but you can still detect a little bit of it at 48 hours. On cardboard, it's undetectable by 48 hours. Now, does that mean if you touch something that somebody else has touched, you're going to get sick? It does not. Washing your hands is helpful, but basically with these packages, you want to make sure that you're using disposable rubber gloves, and you want to also disinfect it before you bring it into the house. Sleep is crucial. You need to make sure you're getting adequate sleep. 7, or in the case of some of my patients, 12 hours a night is what's necessary. You want to make sure that you're getting proper nutrition. Because you're staying home does not mean you get to eat Cheetos and pig out on ice cream. These are not good for your immune system. So we want to make sure you're eating properly in order to get the best possible nutrition to maintain your best possible health. Meditation. Meditation has been shown to improve your immune system, and it will also help you cope in these very stressful times. So regular meditation. We will be sending out videos on meditation, but there's a lot of websites you can go to for meditation. We want you doing meditation as a regular practice, 10 to 20 minutes once or twice a day. Exercise. Just because you're confined inside or out of the office and the gyms are closed doesn't mean you shouldn't be exercising. So we want you out, preferably in the fresh air, biking, walking, hiking, but get out of the house as much as you can. And when you're in the house, make sure you're doing proper exercises, calisthenics, treadmill, whatever. But we want to keep you healthy. Good exercise equals good health and optimal immune functioning. All right. If you go to work, if you've been around a lot of people, when you come home, take off your clothes, throw them in the laundry, and shower. This is one of the best ways to prevent any possible viral droplets from coming home with you. If you've been exposed, meaning someone has coughed on you, you've been in a tight environment where somebody has been proven to have coronavirus or suspect to have coronavirus, you've got to self-quarantine for 14 days. There's a number of supplements that might help. These have been helpful with other viruses, but I want to emphasize that these have not been specifically tested against the coronavirus. We sent out a list of supplements and we've attached them again to this email. We're going to update on a regular basis on the website, kaplanclinic.com, so please, you can use that site as a regular reference source in order to get the latest information. As more research comes out, we'll put out more data. So what are we doing and how can we help? First off, the office is open. All right? We've stepped up our normal infection control procedures 2 weeks ago. The end result of which is we have not seen anyone in the office who has had coronavirus, and none of our staff have become ill. We are thoroughly disinfecting every room after each patient, and we're also cleaning the entire office at a minimum of 3 times a day. That's provided that we're not the least bit concerned that somebody has potentially contaminated the office. So we're doing everything we possibly can to keep this place safe for you, as well as keep it safe for ourselves. We stopped seeing acutely ill people 2 weeks ago, meaning that if you had upper respiratory infections, we asked that we evaluate you over the phone, do a telemedicine visit, but we didn't want you coming into the office and still don't want you coming into the office as an extra precaution to make sure everybody is safe. We see a lot of chronically ill patients in our practice, and it's crucial to us that we keep you safe and keep you out of harm's way. When you come to the office, you're going to notice that we've stepped it up even a few more notches. So now everybody comes in the office, we ask them to put on a mask. We're giving out free masks. So you get a mask as soon as you come into the office, and we ask you to wear it, you can take it home. You'll notice all the staff is also wearing masks, and many of the staff are wearing gloves. All of this is to protect you and to protect us and to protect our community. We're continuing to screen people, and if you're acutely ill, we want to do a telemedicine visit, not an in-office visit. So if you've got fever, chills, upper respiratory infections, call us. Let's figure out what's wrong with you, and let's figure out how to best help. At the Kaplan Center, we've been using telemedicine for over 4 years. This is not a new concept to us. We treat people throughout the country, and so we are regularly set up to do this and regularly have appointments. Indeed, just in the last week alone, I did about 6 hours worth of telemedicine instead of doing in-office visits. The telemedicine is easy to set up. We call this a cloud visit, and you set it up by simply calling the front desk, saying, I'd like to have a cloud visit. They will schedule it for you. They'll tell you how to set it up on your computer. Easy peasy. It really is very straightforward. We've had great success with it over the years. You can also do a cloud visit with our nutritionist. Nora Emery can personalize your nutritional program to optimize your immune system. But the other thing Nora can do is make sure that the supplements you're taking are not contraindicated with the medications that you're taking. So it's really important that we make sure we're matching supplements and nutrition. And if you're adding any other supplements to your medications, Nora can be very helpful in terms of understanding whether or not that's going to be helpful to you or potentially harmful. So let's make sure we're being smart about what supplements we're taking and how we're taking them. You can also do a cloud visit with Rebecca Berkson. Rebecca is our acupuncturist and herbalist. Now, she's not going to be able to do acupuncture with you over the cloud visit, but she is an expert herbalist in Chinese medicine and can give you a great deal of advice about different Chinese herbs that can be helpful for your optimal health in terms of optimizing your immune system, helping prevent the occurrence of COVID-19, but also in terms of things we can do in terms of treating any of the symptoms associated with this virus or other illnesses you may have. The Chinese have a long history of using herbal medicines for a variety of medical conditions. There's a number of studies that have been reported on the use of Chinese herbal medicine for COVID-19, and Rebecca is well read on these things and ready to help. Jody Brayton, our therapist, can also do counseling via the cloud visits. Again, this is something she's been doing for years. These are extremely useful for dealing with personal stress, family stress, marital stress. All of this can be handled on cloud visits as well as they can in in-office visits. Listen, this is a very stressful time. We're all now living in close quarters. So we need techniques to help us manage our stress, which also will then boost our immune system. Jody can help with this, and this can again be performed as a cloud visit without necessarily coming into the office. So cloud visits can be done with the therapist, cloud visits can be done with Rebecca, our herbalist, cloud visits can be done with Nor, our nutritionist, as well as with all of the physicians. As for meeting with the Kaplan Clinic physicians, while we can't do a physical exam of the office, if you have a few things at home, there are things that it can better inform us and better help us in terms of helping you. So having a working thermometer in the house is very important. If you have a blood pressure cuff, not a bad idea. We can also sometimes use that. But what we can do is a comprehensive history. We can make recommendations for medication changes. We can order medications and order testing at the push of a few buttons. So there's a great deal we can actually do for you through the cloud visits. The other thing we're working very hard to do is to stay up to date. There is a ton of information coming out on COVID-19, some of it extremely valuable and useful, and some of it garbage. We are sorting through that and trying to separate fact from fiction and make sure that we have the latest, greatest, up-to-date, most accurate information for you. So we can also give you that in terms of guidance, in terms of self-quarantine, in terms of guidance of self-care. The other thing we've been doing at the clinic for years, and is particularly important this time of year, are immune-boosting IV therapies. We use a number of different IV therapies at the Kaplan Center, from high-dose vitamin C IVs to NAD, all of which can help with improving your immune functioning. We have a list of those IVs on our website at kaplanclinic.com. You simply click on services, click on IV therapies, and there's a long explanation in terms of what's available and what's offered. We utilize these services on a regular basis to take care of ourselves. So I use them in order to do it, and Rebecca is today doing it in order to keep herself healthy. She's not sick, it's about staying healthy, and so that we're in the best possible condition to take care of you. We ask that you check with your physician to get permission to approval to get the IVs, because we want to make sure that they're appropriate for you. So don't hesitate to call and ask your physician as to whether or not this is appropriate, and write the proper prescription IV for you. I want you to keep in mind that we're doing everything we possibly can to keep the office germ-free and safe. With regard to the IV rooms, we're only having one person in the room at a time. We clean the rooms thoroughly, disinfect them after each person has been in that room. So in the next few weeks, we're going to be sending out regular videos to keep you abreast of the latest developments with regards to the coronavirus. Our goal is keeping you informed throughout this crisis, and perhaps maybe even a little entertained. We're here for you, and we can help. Laughter is also one of the best medicines. Seek out opportunities to be inspired. Seek out opportunities to express and receive love. Connect with friends and loved ones. Also, be sure to watch the video attached to this email. Wash your hands, stay safe. We'll work together, we'll get through this. I look forward to talking with you soon.